Okay, let's get into the concept of ethics. Make sure you've got your concept study guide, as well as both of your textbooks ready to go, a notebook, some highlighters, and a pen, and you'll be ready to study along with me. We'll be working through chapter 40 of Giddens and 44 of Davis. So in order for you to come away from this lesson with what you need, here are the things that you need to get out of this lesson. You'll want to make sure you can complete that study guide and answer these following questions on your screen. So go ahead and pause the video here and read through these questions, write them down so that as we get to them in the lecture, you'll be able to answer them fully. So the concept of ethics is defined as the study or examination of morality through a variety of different approaches. In other words, it's the study of what is right or what is wrong. And what dictates our morals is a set of social standards that we've been taught to tell us what is right or wrong. So we are studying the concept of what is right or wrong when we're talking about ethics. Ethics are already at play in your life. Ethics are in every aspect of what we do, both professionally, personally, in research, in organizations, and also in society. We're constantly using ethics and making ethical decisions. It's just not that we're always so aware of it as such. So it is something you're familiar with, but we want to address what it really means to practice ethically as a nurse. So for the attributes and criteria of this concept, there are many sources of ethics that we use in our lives, and you can see them in this image here and in your text. Our ethics, our sources of what influences our ethics come from a variety of sources, things like our family, our religion, society, culture, our profession, and personal experiences, and those all weigh into how we make ethical decisions. Now, ethical problems and dilemmas arise when there's not one right or wrong answer, and each choice comes with both drawbacks and payoffs. And so weighing what is the best choice in a situation is what happens when we are ethically analyzing and making ethical decisions. And so we don't live in a black and white world, and so you have to have a way to fairly and correctly process what is a right decision when there is no perfect answer. And when you're talking about human lives and technology and research and medications, there's all sorts of things that cause ethical dilemmas in healthcare. So what ethical principles should I know and follow? Okay, if you've been tuning out, now's the time to tune back in, because in order to practice ethics, you have to know the principles that are the underlying part of what ethics are. So you're going to need to write these concepts down and then be able to define them and also identify when these principles are being used in a specific situation. So the ethical principles we're talking about are respect for persons, meaning that every individual has inherent dignity and we need to treat people as individuals, and they're never a means to an end. Every individual is an end of itself. Non-malfeasance means do no harm. So we can't do something to a patient that is going to cause them harm. Beneficence means doing good, meaning we practice in a way that is for the patient's own benefit. Justice can have many meanings. I think in the era of social justice and social reform, it has even more profound meanings. And it means that patients and people are treated with equality and fairness in the way they're treated. And that certainly comes into play as we think about how healthcare is delivered in our society and making sure that patients have the right access to that. And your Davis text will even talk about, is healthcare a privilege or a right? And that is something that we have to wrestle with as a society and as individuals. Fidelity means faithfulness to your patient. And so the patient is the most important person in a room when I'm in a patient's room. And while the family members are very important and their wishes are important, it's what the patient wants that I am most faithful to, and what I advocate for when I'm collaborating with the physicians and the other healthcare interprofessionals. It's that is my patient. That's my person, not the family. They're great, but it's really that patient is who I'm faithful to. And finally, the ethical principle of autonomy. Autonomy means the patient has the right to make their own choices, even if they're bad ones. When I was working in the ER, there was a patient, he was 28 years old, and he would come in almost 3 to 4 to 5 times a week by ambulance for his blood sugar being over 700 and all of the complications that he was having from that. And we were talking multiple times a week, and it was just because he was not compliant with his medications at home and his insulin shots. And almost every time he would have to be admitted to the ICU and stay a few days, and he'd go home, and within a day or two he would be back. And I asked our social worker one time, can't we just, admit him to a nursing home and just tell him he has to? This is such a strain on our healthcare dollars, and and it's just not good for him to be in the hospital and be poked with needles all the time. And this is just not what kind of life is this for him? And she looked at me and she said, patients have the right to make their own choice, even if we think it's the wrong one. And in that moment, what she was doing was reminding me of the ethical principle of autonomy, and how even though it might not have been something that I would choose for that patient, we needed to uphold his autonomy and because he had the ability to make his own decisions, to allow him to do that. Now, we could give him our recommendations and tell him the benefits of those, but ultimately it was his choice. Good news on the ethical theory section of Giddens, just go ahead and skip over that. We're not going to get into that for this lecture. So we know that ethical decision-making is a huge component of what we do in healthcare. And we now have a baseline of understanding of some ethical principles that guide our decisions. But how do we go through and make those decisions? Well, the good news is you work as a team. So you don't do this alone. And most hospitals have some sort of ethics committee set up, who go through a systematic approach with ethical dilemmas that are brought to their attention to make sure that they evaluate all of those ethical principles, weigh the choices, and decide what is best for the patient. So what can you do to uphold ethics as a nurse? Make sure you clarify your own values. Knowing where you're coming from and what your influences on your personal ethics are definitely helps you be aware of how that interplays with how you make ethical decisions. Identify moral dilemmas when you see them in the hospital settings and bring them to the attention of the ethics committee so that there can be a systematic approach to identifying how to fix it. You can use a systematic approach like the moral model that is given in your Davis text to help you guide you through decision making. Now, we're not going to go into that in this video, but if you want, go ahead and pause the video. You can look over at that moral model on 1189 of your text to give you more information on that. Look for a compromise. So it's always in gray areas with ethical dilemmas, and so you're going to be wanting to look for a compromise in how you sort that out. Participate in an ethics committee, sometimes peering behind the curtain of the hospitals by working on hospital-based committees can really give you a fuller picture of how this looks, and also give you lots of practice to work through ethical dilemmas on your own. And then finally, improve your ethical decision making. And when we're in class this week, we'll be working through some case studies to do just that. So I want to give you a few key ways that you're going to see ethical issues most commonly played out in nursing. Things like making sure that we're protecting patients' rights and human dignity. One of the short videos you're going to watch on YouTube today is like a 2 or 3 minute patient bill of rights video, because we need to know what our patients' rights are so we can uphold them ethically. A lot of the other ethical issues have to do with restraints, or should we prolong the dying process? And considering the quality versus quantity of a patient's life. And then, unfortunately, working with unethical or impaired colleagues, meaning colleagues that come to work, high or drunk and worried about how that's going to impact the patients that they take care of that day. And what do you do about those situations? Because you have an ethical duty to report and to advocate for your patients and for patient safety. So these are the most common ways you're going to see ethical issues played out in nursing. You can read about these more in detail in your text. So moral distress happens when when you know a way something should play out based on your ethical decision-making and your own ethics, but for some reason, with things beyond your control, that's not actually what's happening in that situation. I'll give you an example of this. When I worked in the ER, we would have about 300 trauma patients come in through the front door every year. And this one time, a 28-year-old kid came from a drive-by gunshot, and he had 3 gunshot wounds to his abdomen. And as he was there, we were literally squeezing bags of blood to get them to infuse faster into him. And I stood by his head, and I watched his eyes closed, and I watched him die because we just couldn't get enough fluids into him fast enough to transfer him and get him to an operating room. Fast forward a week, and I went to shadow a friend at another hospital, and in every single one of their trauma rooms, they had a $30,000 rapid blood infuser that can infuse a bag of blood in less than a minute. And I just thought about that kid and whether or not, if we had had a $30,000 rapid blood infuser in every single one of our rooms, if he would have had a different outcome. And that has to go back to the ethical principle of justice. And is it fair that some hospitals have more resources than others? Is that fair treatment? Is that justice? And so we have to grapple with this moral distress and how that impacts us as nurses. And some things are in our control and some things are not. And when we are exposed to that kind of moral distress, there can be all sorts of different feelings that we come away with, like frustration or anger or guilt, anxiety, withdrawal, self-blame, and other stress-related symptoms. And so we just need to be aware of that. And again, practice self-care, know who to talk to and how to work through those feelings, because there will be situations in your career that are beyond your control. And you just have to do whatever you can within your sphere of influence to do the best you can for your patients. So let's talk about some interrelated concepts. Now, just like safety kind of, the concept of safety permeates everything we do as nurses, the concept of ethics also permeates everything we do as nurses. And so we have to have ethical practice. We have to have ethical patient care. We have ethical obligations in everything we do in terms of how we lead and how we collaborate and how we practice with safety. And then we have to have ethical guidance and prevent conflict of interest in how we're treating our patients. And so you see, there are many, many different concepts that interplay with ethics. So it is something that we teach the beginning of your first nursing course so that it becomes a foundational concept that you use throughout everything you do. There are a few exemplars in your Giddens text I'd like you to read through, paying most attention to the ones about confidentiality and advanced directives. And there will be a short 2 or 3 minute video about advanced directives in your Blackboard as well. So who sets guidelines for ethical nursing practice? There's a few different organizations that do: the International Council of Nurses, the American Nurses Association, as well as the Joint Commission, who gives accreditation to hospitals. Now, most commonly, people associate the American Nurses Association Code of Ethics with the ethical guiding principles. Now, keep in mind, these principles are not legally binding, but they certainly are something that boards of nursing consider when they are considering issues that they're having with nurses. And so what is this code of ethics? This is in your Davis text, but I think it's even easier to see on the link on Blackboard that goes directly to the American Nurses Association Code of Ethics. There's 9 different parts of the Code of Ethics of Nursing, and I'll have you read those on your own. That's it. I hope you took what you needed. Make sure you look back at these objectives at the beginning of the lesson. Make sure you've answered all of the questions that were there. If you did, then you've gotten the gist of what you needed to get out of this lesson. See you later.